Welcome, welcome, welcome. Buckle in, strap up, because over the next few videos in this mini course, you are going to level your business up. It's time to put on your big girl panties, your big boy panties, because we are going to delve into the world of paid marketing. And I am going to teach you how to run your first successful paid ads as a health coach. Now, you're probably wondering, who the heck am I? Should I even listen to this dude? Why is he qualified to teach me about running paid ads as a health coach? Allow me to quickly introduce myself. My name is James, and I'm currently one of the co-founders of the Undiet Company, which is a health coaching business that does anywhere from $50,000 to $90,000 per month currently in revenue. And in that business, we spend over $10,000 per month on ads, just in that business. And on top of that, I'm also the founder of a business called Hardbox Marketing. And that we are a marketing agency, and we over the past maybe 6 or 7 years, I don't know the exact time frame, we've spent over $6 million across over 100 of my different clients' accounts. So I've spent a lot of money on ads, and more specifically, I've spent a lot of money and continue to spend a lot of money to this day on ads for health coaching businesses, my own health coaching business, as well as many of our clients' health coaching businesses. And just to give you an idea, in the funnels, the sales funnels, the advertising funnels that I'm going to teach you in this mini course, we have spent in the past 60 days, when I took this screenshot, that was probably a few days ago, but in the 60 days before I took that screenshot, we had spent almost $17,000 on ads just in the sales funnels that I am going to teach you across that 60-day period. And although we spent $17,000 on ads, I know that sounds like a lot of money, and it is a lot of money. But we spent $17,000, and from that 17K, we were able to generate 1,875 new leads. And from those 1,875 new leads, we were able to book 268 sales calls. And that turned into a lot of sales, and we made many times our money back from that 17K that we initially spent over those 2 months. So when you enter the world of paid marketing, you have to pay to play. You spend money to make money. And the problem is that most people spend money, and they spend money, and they spend money, but they never actually get to the making money part. Most people suck at running ads. Not just health coaches, but in all businesses, but especially in the health coaching industry. Most dietitians, nutritionists, they suck at running ads. Instead of spending money to make money, they just burn their money, they light it on fire and watch it go up in ashes. But that's not going to be you. Well, at least from this moment forward, it's not going to be you. Maybe you've lost some money on ads in the past, but it's no longer, because you are here and you're going to watch these videos and you're going to listen to James, aka me, and you are going to learn how to run your first successful ads as a health coach. And before we get into the actual ads that we want to run and what kinds of ads we want to run, I want to show you what doesn't work. Because a lot of these things might work in other industries, but in the health coaching industry, we've tested almost everything you can imagine, and we've found what does work well and what doesn't work well. So to save you tens of thousands of dollars and years or months of wasted time, I'm going to show you what you shouldn't be doing as a health coach trying to run ads. The first thing you shouldn't be doing is sending people from an ad to a sales page and asking them to buy straight away. That might work in e-commerce, it might work in other industries, but as a health coach, if you're sending people to your website to a page that says book a consult with me or sign up to my program straight away, and it's just an informational sales page or an information page with a link to buy, you're not going to convert. You might get a couple of clients, but you're going to be wasting money on ads. You're going to be burning money, and you're going to have a negative ROI. You're going to be spending more than you make back, which no one wants. Ideally, you want to spend $1 and make $2, $3, $4, $5, $10 back per $1 you spend on ads. And with an ad to a sales page, with a checkout, you're not going to get there. What else doesn't work? Well, an ad to your website homepage. I see an alarmingly high number of people in the health coaching space do this. They will say, I've tested paid ads before. And I'll quiz them a little bit. I'll say, what have you done? Walk me through what you've done. And they've literally just put an ad up and send people to their website, which, first of all, their website, for most people, it isn't optimized. It's a shitty old website. And even if they have, where did my camera go? Let me pause that and get my camera back. All right, we're back. My camera decided to go walkabout for a second, but that's okay. As I was saying, people send People from health coaches send people on the internet from an ad straight to the website, and most of those health coaches do not have optimized pages at all, website pages at all. And even if they do, it's just a non-optimal way, because you're just sending people to a maze and saying, hey, here's my little maze, go off and find your own thing and do whatever you want. You don't want that. You want to send people to a specific page that has a specific action that they can take. Or if you're not going to send them to a website, you still send them from an ad to a specific location with one specific action that they can take. Don't leave it up to them to choose what they want to do. So no sending people from an ad to your main website. The third mistake I see people make is selling low ticket offers through ads. Now, what do I mean by low ticket offers? A low ticket offer is something that doesn't cost much, a $20, $30, $40, $50 something. That something could be an ebook or a guide or a PDF or a masterclass or a mini course, whatever it might be. It is just a cheap something with the idea that you sell people for a cheap price, and then you have a customer that you can upsell in the future. You can give them maybe an ebook now, and then in 1 month time or in 2 weeks time, they will become a main customer of yours and spend thousands of dollars with you. Sounds good in theory, and it might work in other industries, but in the health coaching space, I very rarely see people do this effectively unless they've been in the space for a long time, have a lot of marketing experience, or have a marketing team behind them. If you are a solo health coach who isn't an expert marketer, then using low ticket offers isn't going to be the best thing for you to do. So forget about your ebooks, forget about your cheap shit, and just focus on your primary program or service offerings. Got it? The next thing that doesn't work is complex sales funnel. For example, you might have a low ticket offer on the front end, a ebook or whatever, but then people purchase it and then it pops up with, hey, would you also like to add this ebook or this one-off call? Or would you like to add this? And they click no, then it takes them to another page that says, what about this? Wait, don't go. I'm sure you know what I'm talking about. Everyone's been through a complex sales funnel at some point. But for health coaches, e-commerce, it works great, and other industries it might work great, but in the health coaching space, unless, once again, you have a marketing team behind you or you are an expert marketer, it is very hard to do that effectively. So just forget about the complex shit and focus on the basics. Focus on the simple, easy sales funnels to implement. And the fifth and final thing that doesn't work that I see commonly is people using weak ads. They go, oh, I've spent money on ads. I spent $500 on ads and didn't get a single customer. And then you go, okay, show me your ads. And they're just the shittest ads you could ever imagine. Weak sauce, bad ads. We don't like that. So I'm going to show you how to do, in this mini course, I'm going to show you how to do good, simple ads that don't take a lot of effort or skill to make, but will still convert like crazy. Now, if you have watched some of my other videos or other mini courses, you will know that I am a big advocate for selling on the phone. Do not send people straight from an ad or your social media profile or from wherever to buying straight away, paying for a one-off session with you or buying something. We want to get people on the phone, a free call. Call it a discovery call. Call it a sales call. Call it a get to know each other call. I don't care, but it should be a free call where you essentially sell them into your high ticket somethings, your high ticket program. That's what I like to, this is the model I advocate for. Sales call to high ticket program. It's something that costs over $1,000 that you offer people. But alas, you can do what you want. Don't listen to me. Why would you listen to me? I'm joking, of course. But the main thing is have a sales call. That's what we're going to do here. So all of the basic sales funnels that I'm going to teach you in this mini course are going to follow this model. They're going to assume that you are going to be booking calls. So I'm going to say, okay, we're going to do the DM funnel. Once again, I'll get to that in a second, but we send people to your messages in the DMs and then we get them to book a call. Or maybe it's something else, but the ultimate goal is always going to be to book people in for a call. It might take one step, it might take 3 steps, but you need to book people in for a call. And without further ado, drum roll please, the best ad funnels for beginner health coaches, not beginner health coaches, people who are beginners to running paid ads are, number 1, the DM funnel. And that's exactly what it sounds like. We're getting people into our DMs, into our private messages, and we're messaging them, then we're getting them to book a call. But we're going to go through that in another video in more depth. This DM funnel is not for people from the UK, from Europe, or from Japan. And you might be thinking, what the fuck? it's pretty random. The reason I say that is because the privacy laws in these countries don't allow you to message people first as a business who haven't first followed you on social media. So if you are getting cold people, cold meaning they've never seen you before, they don't know who you are, they're coming across you for the first time. If they're seeing an ad and they're clicking on an ad to start a conversation with you, you cannot start a conversation with that person and use the DM funnel unless they A, have their privacy settings tweaked, their default privacy settings tweaked, or B, are from a different country, or C, follow you first. If you are from the EU, the Europe or Japan, then you might want to, the UK, EU or Japan, then you might want to instead do the follower funnel. That's the reason I have two here and not just one, because depending on where you're from and also depending on your social media and if you like social media or not, that will determine which of these funnels you will do. So if you are not from any of these countries, that are listed here, then I would recommend starting with the DM funnel. It's great. Follower funnel is also really good as well. Both are really good. Maybe you want to watch both the videos that I have in this mini course, one on each of those funnels, and decide for yourself which you think will be best. Apart from that, I will see you in the next video where I will be going through each of those funnels in more depth. Adios, amigos.